Good evening. It's great to see so full a room, and believe me, I do this a few times a year, and especially so full a room in a relatively small community says a lot about the people who live here, and it's a pleasure to be here. Thank you for inviting me. So I get this call from our speaking agent that this pregnancy center in northern North Dakota wants me to come and speak in late September. I live in central Arizona. I thought I was going to have to find my parka somewhere, maybe my bomber jacket at the very least. And then I look at the weather a week ago and I go, there's only a 5-degree difference between here and Arizona, so it's not bad. Must be like this all the time, right? Yeah, I grew up in upstate New York. Believe me, I know what winter is like. The story I'm about to tell you is not an easy one to tell, and sometimes it's not an easy one to hear. But I promise you that everything I'm telling you is firsthand and true. What's it like to be an abortionist? I want you to imagine for a minute that you're an obstetrician gynecologist like me. And I want you to imagine, if you can, that you're a pro-choice obstetrician gynecologist like I used to be. Your patient today is 17 years old. She's 20 weeks pregnant. Her uterus is all the way up to her umbilicus. She's been feeling her baby kick for the last 2 weeks. Now, if you could see her baby, and that's easy on an ultrasound, a baby at 20 weeks, look at your hand, is the length of your hand from the tip of your middle finger to your wrist. That's a 20-week baby, not counting the legs. But now she's asleep on an operating room table, and you're there to help her with her problem. You walk into the operating room scrubbed and gowned, and on the right there's a table with your instruments. The first thing you reach for is a suction catheter. I know this is a big room. This is a 14 French suction catheter. It's clear plastic, it's a hole through the center. And picture yourself putting this up through the uterus and instruct your circulating nurse to turn on the suction machine. And what you'll see is pale yellow fluid running through the tubing into the machine. That was the amniotic fluid that was there to protect the baby. Now, if she were only 12 weeks pregnant or less, look at your hand again. The width of your hand is a 12-week baby, head to rump, not counting the legs. You could pretty much do the whole abortion with this one instrument. Babies this big don't fit through catheters this size. So you want to reach for your SOFR clamps. You didn't have to imagine I brought one along. It's about 13 inches long. It's stainless steel. The business end is about 2.5 inches long and a 1/2 inch wide. And if you could see this, it has rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. A second trimester D&E abortion that I'm describing, the way I used to do them, is a blind procedure. You can use ultrasound, but frankly, it only slows things down. Picture yourself putting this up through the uterus, through the cervix. Be careful not to perforate the walls. They're thin and soft. And grab anything you can blindly and pull. And I do mean hard. And out pops a leg about that big, which you put down on the table. And reach in again. Grasp and pull hard. Out comes an arm about the same length, which you put down on that table. And reach in with this instrument again and again and tear out the spine, the intestine, the heart, and lungs. Head on a baby that size is about the size of a plum. Can't see it, but you're pretty sure you've got it if you've got hold of something and your fingers are spread as far as they will go. And then you crush down and you take out skull pieces. Sometimes a little face comes back and stares back at you. Congratulations, you just successfully performed a second trimester D&E abortion. You just affirmed her right to choose. You just made $800 cash in 15 minutes. And I will hasten to remind you that I'm talking about $800 cash in 1984. That's the equivalent of $2,500 today. Now, I graduated from medical school in 1976, and if you asked me how I felt about the abortion issue, I would not have hesitated for a second to tell you I was pro-choice. This is a decision between a woman, her doctor, and no one, including the baby's father, has anything to say about it. You know, a lot of people identify themselves as pro-life or pro-choice. For many people, it doesn't affect their lives directly. It doesn't even affect how they vote. But when you're an obstetrician gynecologist and you say you're pro-choice, This isn't some vague political position. You have to decide whether you're going to actually do those procedures. So in my training as an obstetrician gynecologist, right along with learning how to do deliveries and hysterectomies and all the things that obstetricians do, I learned to do first and second trimester abortions. Now, technology was a little different in the 1970s, late 70s. There was no medical abortion. We're going to talk about that later. But if patients were 12 weeks pregnant or less, we would bring them into the, believe it or not, the delivery room, and we would do suction D&C abortions on these patients. And when it was my turn to do them, I'd do 2, 3, 4 in the morning, never thought anything of it. If they were more than 12 or 13 weeks pregnant, we would make them wait several weeks and bring them back for saline abortions. These aren't done anymore, but suffice it to say that these women had to go through labor, and it would take anywhere from 8 to 36 hours for them to deliver their usually dead children. But I was dedicated. I felt this was the right thing. And that was my life and my training. It was during my first year of training that I was working at the hospital at night, and I went down for a break at the cafeteria, and an attractive young nurse came and sat down next to me. Neither one of us realized that we would be married together about a year later. And my wife, Seal, and I, we started to date and found out very quickly that we were on opposite sides of this issue. Now, New York had legalized abortion 3 years before Roe versus Wade. And when she had been, and she was pro-life, she wanted nothing to do with this. And when she had been approached as a nurse, as a nursing student, when asked if she would assist with these procedures, she said, absolutely not. She would have nothing to do with it. And that was the end of it as far as she was concerned, because she ultimately involved, and she was one of the first nurses trained to do renal transplants. Had nothing to do with OB, and she figured that was the end of it until we met. But as I said, it didn't take us too long to find out we were on opposite sides of the issue. And that's when we made the first and most fundamental mistake in our relationship. Instead of discussing it and hashing it out and coming to some kind of resolution, we ignored it. It was easier. The problem with that, of course, is if you ignore one important issue in your relationship, it's too easy to ignore others as well. We got married, and like young couples, we laugh at it now. We thought we were so old, we were in our late 20s. We wanted to have children of our own and found out pretty quickly we had an infertility problem. She just was not getting pregnant. I sent her to the best infertility specialist in town. Now, any woman who's been through an infertility workup knows that it is difficult, painful, embarrassing. And she would come back from those visits, lock herself in the bathroom and cry. Because two ironies were not lost on her. Here she is married to an OBGYN and she can't get pregnant. And two, here she is trying to get pregnant and her husbands are killing babies doing abortions. But she would push that thought out of her head as soon as it came in. After a lot of workup and already one surgical procedure, her physician came to us and said, there's one more procedure I can try. It should take about an hour and a half. And when he walked out of the operating room 4.5 hours later, I can still remember the room we were standing in his face when he looked at me and he said, look, I never tell anyone that they're not going to be able to have children, but don't count on it. We were devastated. We were both from large families and wanted to have a family of our own. After we got over that shock, we decided, well, okay, if these are the cards we've been dealt, we'll adopt a baby. We'd be delighted to take another baby into our home and take care of as our own child. And anyone who's tried to adopt a baby knows how difficult that is. We called religious agencies, state agencies, county agencies. We tried everything we could, and after months of effort, the best we could do was get on a 5-year waiting list to get on the actual waiting list. And it was during that time that I had my first doubts about abortion. They were strictly selfish. I'm not an idiot. I know that part of the reason why there are so few babies to adopt are guys like me doing abortions. As I said, my doubts were strictly selfish, but I remember a very specific abortion doing a first trimester abortion in the delivery room, just me and the patient, and looking at this parts afterwards and thinking, gosh, I'm throwing kids in the garbage. Wouldn't even one of these women allow us to take her baby home and care for her as own? But of course it doesn't work that way. After months of that frustration, my wife will tell you I came up with probably the best idea I've ever come up with during our relationship, other than my asking her to marry me. And that was, this is ridiculous. We're getting nowhere with this adoption thing. I know 50 obstetricians on a first name basis. Let's advertise. Maybe we'll get lucky. Some kid will fall between the cracks and we'll be able to get a private adoption, and that's what we did. In August of 1978, months after we started that, I was working in the operating room with an attending physician doing a case when the circulating nurse tapped me on the shoulder, and when I turned around, she was holding up a piece of paper that said, "Call Marcia as soon as you're done." Now, Marcia was the head of social services at the medical center where I was working. That's all it said, but she was one of the people we had talked to. As I said, that's all the message said, but I knew what it meant, and sure enough, when I called her, she informed me there was a 15-year-old girl in labor in the delivery room. She had had no prenatal care. The first time she saw a doctor was the day before. But she's healthy. The baby looks healthy. She wants to give her baby up for adoption. Are you interested? Oh man, of course I was interested. I remember staring at the face of the telephone to call my wife with this news and know that I was just 7 digits away from becoming a father. And literally, by the grace of God, we were able to adopt a little girl that we named Heather in August of 1978. Fantastic. We finally have a baby. After all the years, after all the tears, after all the doubts, we had a baby of our own, and my wife got pregnant the very next month. And our son Sean was born in July 1979. Sean and Heather were literally and figuratively close. They were only 10 months apart. Anyone who didn't know Heather had been adopted would look at them and go, 10 months apart? Man, you didn't give your wife much of a break, did you? But hey, I got the proverbial millionaire's family. I've got a son and a daughter now. And any doubts I had about abortions simply evaporated, and I went back to business as usual. I graduated from my residency program in 1980. We moved to the west coast of Florida. Found out pretty quickly that a young couple with young kids didn't belong in a retirement community. So we pulled up stakes and moved back to upstate New York after a year, and I set up practice with a physician that I had trained with. Now, Bill and I were practiced abortionists. We were not running an abortion clinic. This was a regular OB/GYN office like most women in this room have been to at one time or another. We did deliveries, we did hysterectomies, we did everything, but abortion was part of our practice. And in the early 80s, those of us in the abortion industry were looking for a better method of second trimester abortions, the later abortions. The saline abortions that we'd been doing up to that time were difficult, very difficult for patients, very difficult on staff, dangerous, prolonged hospital stays. It was a horror show. And we wanted a method of second trimester abortion that was like D&C. We wanted a method where the patient would go to sleep, and when she woke up, it would all be over. And that's when D&E abortions were being developed. Now, there were a lot of abortionists, other doctors who were doing abortions in Albany, where I was working, but nobody would touch that procedure, and we saw an opportunity. So we trained ourselves to do these second trimester abortions, and we were getting referrals from other doctors to take care of their patients doing these. Over the next 4 years, I did 1,200 abortions. Over 100 were the D&E abortions that I described. But hey, life's good. We're finally making some money. We can afford a home. We can afford some decent furniture. The kids are growing. And everything was just lovely until June 23rd, 1984. June 23rd was a Saturday. It was a beautiful day in Albany. I was on call, but it wasn't very busy. I made rounds and we got to spend the rest of the time with my wife and the kids. We took the kids to an amusement park that afternoon. We had dinner together. And that evening, the kids were playing in the backyard, and we had friends coming over for cake and coffee. We were talking with our friends, And at 7:25 that night, we heard the screech of brakes out in front of the house. The kids had gone on the road. Heather had been hit by a car. She was a mess. I'm a doctor. I'm supposed to be able to save people's lives. My wife was an intensive care nurse. This was our work. We did the best we could, but it made absolutely no difference. And she died in our arms in the back of an ambulance that night. If you have kids, you may think you have some idea of what that's like. If you haven't been through this yourself, you have no idea. I hope you never find out. But what do you do after a disaster? You bury your child, take some time off, and then you try to get back into your life. And I don't know exactly how long it was after Heather's death, but I showed up at OR number 9 at Albany Medical Center just like I had over 100 times before for a second trimester D&E abortion. I wasn't thinking of this as anything special. I had other things on my mind. And I started that procedure, and I reached in with that Sofer clamp, and I ripped out an arm or a leg, and I got sick. You know, earlier I talked about stacking up body parts on the side of the table. That's not to gross out the nice people that came to the dinner. When you do an abortion, you have to keep inventory. You have to make sure that you get 2 arms, 2 legs, and all the pieces, because if you don't, your patient will come back infected, bleeding, or dead. So I finished that abortion. And I know it sounds strange, and I promised you, everything I'm telling you is firsthand and true. For the first time in my career, after all those years and all those abortions, I really looked at that pile of body parts on the table. And I didn't see her wonderful right to choose. And I didn't see what a great doctor I was taking care of her problem. And I didn't even see the $800 cash I just made in 15 minutes. All I could see was somebody's son or daughter. And it occurred to me in that moment that this patient had come to me figuratively, never literally, and said, "Here's $800, kill my son or daughter." And I was the kind of person that would, with no compunction whatsoever, take that money and say, "Sure, I'll do that." Well, needless to say, we were in a crisis. I told you that when you stop talking about one important thing in your marriage, sometimes you start skipping other things too. And we'd been drifting apart. Heather was exactly 2 months away from her 6th birthday when she was killed. Sean was just a few days away from his 5th birthday. And we almost mourned separately. I didn't just stop doing abortions. I told you I was dedicated. I mean dedicated. And I knew I would get through this. So I soldiered on. But my wife always knew when I had abortions scheduled the next day. I was hurting, and I got into this blame game. It's the girl's fault for getting pregnant. It's the nurse's fault for scheduling it. It's the hospital's fault for allowing him. It's everybody else's fault but mine. Isn't it always that way? And after a few months of this, my wife had had it up to here, and unbeknownst to me, she had packed a bag and she was 5 minutes from walking away with my son. But she was going to have her say. And she broke our unspoken rule and started talking about the abortions. You know what? It's not the girl's fault, and it's not the hospital's fault, and it's not the nurse's fault. You stupid idiot. It's your fault. If you're feeling so bad about this, why don't you just quit? That was the opening salvo in what turned into a 2-hour conversation about a lot of issues. And I'm glad to say she did not walk out afterwards. But I went to my partners the next day and told them I would no longer do any more second trimester D&E abortions. It was just too difficult. I would keep on doing the little ones, the suction D&Cs we were doing in the office. And for a few more months, I soldiered on doing those. But a change had occurred that I couldn't take back. You think doctors are so smart? We're no different than anybody else. When you finally figure out, here, not here, that killing a baby this big for money is wrong, it doesn't take you too long to figure out that it doesn't matter if the baby is this big or even this big, it's all the same. Now, we've had the privilege of talking to a lot of different groups, including students in colleges, and I remind those students of something. It is so easy to talk about disposing someone else's life. Today, you're an adult. Once you were a child, you didn't look anything like you look today. Once you were a baby, once you were this big, but it was always you. And I'm ashamed to say it was February of 1985 when I finally went to my partners a second time and told them I would no longer do any more abortions, and I never did another one after that. Get out of abortions? Now you know why I quit. Get out, get involved in the pro-life movement? Not a chance. You see, I'll tell you a little secret. Everyone in the abortion industry knows that everyone who's pro-life is a kook. I know this because MSNBC tells me so, and they would never lie to me. Months after I stopped doing abortions, my wife told me that we had been invited to a pro-life potluck dinner by somebody at our church. And I laughed. And I said, why would I want to go to some pro-life dinner with a bunch of kooks? And you think God doesn't have a sense of humor? Look at this. It was on a Friday night. I had an easy out. We had another commitment. But as it coincidentally turned out, and I understand coincidences better now, it was on the road to where we were going. We had to pass the pro-life dinner to get there. And when we were driving, I looked at my wife, who was very cynical, and I said, you know what, just for the heck of it, let's stop at the pro-life dinner for 10 minutes. We walked in, everybody looked up, it looked like a scene in a bad movie, and the place went dead quiet. I had no idea these people knew who I was, but they did. And a lot of them didn't know I wasn't doing abortions anymore. I didn't take out an ad, I just quit. Well, we ended up spending an hour and a half at the pro-life potluck dinner, and guess what? These people weren't kooks. They understood the medicine, they understood the law, and they were giving their time voluntarily and sacrificially, like the folks at Relate Care, to stop what they saw as the worst human rights abuse of our time. We were very impressed, and we joined that group, Citizens Concerned for Human Life, a pro-life group in Albany, New York, and it was sometime after that my wife and I started speaking. Now, you can hear a story like this, and I would understand if you said, okay, great, he's a doctor, she's a nurse, they're both involved in healthcare. But what's that got to do with me? I'm not in healthcare. I'm a mom, I take care of my kids, I'm an accountant, I'm a farmer. I don't have anything to do with this. How could I possibly make a difference in something this big? I understand how you would feel that way. Sincerely, how many people in this room think you could do anything with God behind you? I'm going to challenge you to act that way. Votes matter, that's number one. Absolutely. But the power of one person with God behind them is immense. Well, back a little bit. 1983, I'm still doing abortions on a regular basis. I arrive at my office and I see something that no abortionist wants to see. The local pro-life crazies are picketing our office. And people ask all the time, you know, if any of you have ever done this kind of thing, I mean, it's like, what's it like? What are you thinking while we're outside picketing? I'll tell you what we think. It gives us a siege mentality. It's us against you kooks outside. But it was at that time that I got a new patient. Her name was Susan, short woman, didn't even come up to my shoulders. And she came as a new patient for routine GYN exam and a pap smear, nothing special. And when it was over, she looked at me and she said, "Can I talk to you?" Now, doctors in the room know, especially with new patients, and I think especially with women in my experience, they won't tell you what's really on their mind till they develop some level of trust. So this wasn't all that unusual. So I sat her down in my office, look at her very professionally and say, how can I help you? And this woman blows me away when she says, I've been sent here to give you a message that Jesus loves you. He cares about you. This is not what he had intended for your life, to be an abortionist. Please stop. No patient had ever spoken to me that way. And believe me, doctors listen to their patients. And I had one overwhelming thought when she said this, and that was, I got to hustle this kook out of my office as fast as I could, and I did. Now, understand something. It's not like my wife and I never darkened the inside of a church, but people who were very demonstrative about their faith always made me uncomfortable. A year later, she shows up for her GYN exam pap smear, and when it's over, she goes, can I talk to you? I went, oh, no. And she does it again, almost word for word. I've been sent here to give you a message that Jesus loves you. He cares about you. This is not what he had intended for your life, to be an abortionist. Please stop. Now, believe me, I remembered what she had said the year before, but in the intervening year between those two visits, I had gotten at least 3 personal greeting cards from this woman mailed to my office, marked confidential, with the message on the card. One time during the intervening year, I arrived at my office and there was a plate of brownies sitting on my desk with a message tied to the brownies. How long would you have, and then she's not stupid, she knew what I thought. How long would you evangelize someone who thought you were nuts? She did it for 7 years. You know, abortion's changed a lot. And I was talking with Jill about abortion law in North Dakota. And I understand you have a heartbeat bill, but it's been enjoined by the court, so basically it's wide open right now. We'll see where all that goes. But even I was privileged to be in Indiana a couple of months ago, and you know, Indiana, man, abortion's flat out illegal. And people there think that they're so safe after the Dobbs decision, overturning Roe v. Wade, and now their state's outlawed abortion. Well, it doesn't mean a thing. Because medical abortion, now, you want to be an abortionist, you don't mean, when I did it, you had to have some level of skill. I won't go into it, but I can tell you about some hairy complications that I had during some of the abortions I did. They all turned out well, but it can be nasty. But now, if you're a nurse practitioner, a physician's assistant, non-physician, if you can write a prescription, that's all you have to do to be an abortionist. And with internet abortion clinics and mail and abortion pills being mailed into the state from outside the state, you think the state can monitor the contents of every envelope that comes through your postal system? No way. And this is being pushed and pushed and pushed. I'll tell you a fact not most people don't realize. How many obstetrician gynecologists are even willing to do abortions? This has been looked at, the research has been done 3 times in the last 10 years, and it consistently shows that over 85% of OBGYNs refuse to do abortions. So the ones that do have a heck of a job. And the abortion industry knows that access, the ability of women to find people who are willing to do abortions, is their weak point. And mail-in pills was a blessing. Because now, all you have to be able to do is write a prescription. That doesn't take much skill. And if your patient has complications, who cares? Just go to the emergency room, and I'm going back to sleep. That's the way it's done now. So don't feel safe. Abortion is in your communities. You know this. And that makes the pregnancy care centers, like the Relate Care Clinic, that much more important. It's vital. I left my practice in 1990, actually went to law school, but we kept speaking. When I stopped doing abortions, the partners were very understanding. They knew what had happened. But when my wife and I got active in the pro-life movement, this was not cool. We lost every friend we had. The phone stopped ringing, the invitations dried up, and it was a very lonely time for a while. But God was good, and He filled that void with new pro-life Christian friends. And many of them were a model to us about what it was to be a Bible-believing Christian and how you live that way. And many, many people helped us on that road. I could tell you 100 stories, but there's one in particular I always remember. I had left the practice in August of 1990. A few weeks later, we were still in New York, and I crossed the border from New York into Vermont to do a presentation in a high school gymnasium on a Saturday morning. Maybe 50 people showed up. And when it was over, this woman came up to me. She was another short woman in her 70s this time, being very gracious, chattering away at high speed. And, oh, thank you so much for coming and doing a presentation. And isn't it beautiful what Jesus is doing in your life? And I'm going, oh, go on, another one. And I felt like an idiot. I felt like a fraud. I didn't want this woman to think that I was something that I wasn't. So after what I hope was an eloquent presentation, I looked at her and stammered like a dope and went, well, ma'am, I don't feel about Jesus the way you do. I'll never forget. She stopped chattering. She got a big smile, and she looked up, got a big smile on her face, and she said, he knows you, sweetie. He's going to get you sooner or later. And she walked away. And he did. A few months after that, we finally found a Bible-believing church, and the minister who brought us the last bit of that journey toward accepting Christ he didn't know any of this, but he'd been around a long time, and he said, in my experience, a lot of people help you on the road to Christ. Wouldn't it be nice to go back and thank them? Well, of course, the first person I saw was Susan. Like I said, she'd been keeping up her one-woman war for 7 years. I invited her out to lunch, and she was very happy to hear the news. And then I found out something that I did not know before. She was one of those people picketing my office in 1983. And I would have never understood it before, but I understood it now when she said, I can't explain it to you. I was just called to go to you specifically as my physician and give you the message that I fought it, said I didn't want to patronize an abortionist. She said, but the more I fought it, the more I felt I was called to do it, and so she did. If there is somebody who's doing abortions in your town, befriend them. You are going to get nowhere. No one gets anywhere by standing outside of a doctor's office and yelling, murderer! Doesn't work. Yeah, it's for you. Get a relationship with them. Take them out to lunch. Share your faith. And don't expect a good reception. Just keep it up. Trust me. Been there. Done that. There was a woman, kind of getting on that theme of what one person can do. There was a woman in our pro-life group. She was a widow. And she was a pro-life jack of all trades, and she'd do anything you needed. If envelopes needed stuffing, she'd stuff them. If she needed somebody on the phone bank, she'd be on the phone. But there were two things she did herself that she particularly loved to do. One was she would go into the schools and the local schools whenever she could get in and do a pro-life presentation. The other thing she did was, again, in Albany, there were dozens of abortionists to choose from, but for whatever reason, she had latched onto one particular physician. And she began to pray. She never talked to that physician, but she began to pray for that physician by name every night. And she found the physician's, it was a male physician, she found out the name of his wife and his 2 daughters, and she prayed for the wife and those daughters by name every night. And she did that for the longest time. One day she was scheduled to go into one of the schools and do a presentation. She woke up really not feeling well. She tried to get a substitute, couldn't find somebody, so she dragged herself out of bed and went into school and did that presentation. That night, the family of one of the students was sitting around the table, and they asked their 13-year-old daughter the eternal question, what happened in school today? And the daughter proceeded to tell them about the presentation that this woman had given her and had given to the class, and she was very impressed by it. And she looked at her parents, she said, I I just don't understand how any doctor could do that to a little baby. Unbeknownst to her, her father, sitting right next to her, was an abortionist. Not only was he an abortionist, he was the abortionist that woman had been praying for. That little girl was a girl that woman had been praying for by name for a long time, had no idea that God put that child right in front of her. And totally innocently, that child went home and witnessed to her daddy, who was so afraid that his little girl would find out what he did that he quit, and he never did another abortion. That's the power of one person with God behind them. You have a great opportunity tonight. You don't have to be in healthcare. You don't necessarily have to go into the schools. If you would, please do. You don't have to reinvent the wheel, because Relate Care Clinic is in your community. Now, my wife and I have been doing this a long time, and we've had the privilege of seeing many, many, many pregnancy centers. Jill took me on a tour of your pregnancy center, and it's very, very impressive. It's well set up. It's obviously very well run. And they're coming to you tonight to appeal for your assistance to allow them to continue to do that work. The vast, vast majority of the money they get does not come from government. It comes from you. Without you, there's no free pregnancy tests. Without you, there's no ultrasound. And that ultrasound is so critical. It has been shown again and again and again. If a woman sees her baby on the screen and that baby becomes very real, over 85% of those women will not abort. If dad sees his baby on a screen, the numbers are even higher. Without you, there's no one, they can't get into the schools to give that pro-life message. Without you, there's no mentoring programs and father programs that are so vital to your community. You make that happen. If you're moved to pray for the center, please do. If you feel called to volunteer with the center, please do. But when they come tonight and they ask for your support, please, please be generous. Your dollars will save lives. You'll never know. I have no idea if I've saved any lives over the years. I'll find out someday, and so will you. So when they come tonight, be generous, pray for them, and support their work, because you have an incredibly well-run center. Your dollars will be stewarded very, very carefully. Thank you for your attention. God bless you all. Appreciate it.